you can stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, Mr. Chair.
Morning, everybody. Good morning. Good morning, all. Looking for an approval of the county board minutes.
Also move.
Second.
Motion and second on the board minutes. Any discussion? Hearing none. Those in favor?
Aye.
That motion passes.
You turn on your mic, please.
Mike's on.
Excuse me. Are there any additions or deletions to the agenda?
Not at this time.
So moved.
Second.
Discussion? Hearing none. Those in favor?
Aye.
Aye.
Opposed? That motion passes. Next item of business is soil and water, and I see Helen is with us this morning. Good morning, Helen.
Morning, Alan.
Morning, Helen.
I'm sure you've got a lot of good information for us today, and as I recall, it's going to start with, the Rum River Major Watershed District, and I'm wondering if you could take off from there.
Well, thank you for allowing me to come first, because as you know, we're going to steal Mike and go on the Chaminade Crookneck this morning after your meeting and take a strong waterfront look at what the damages are up there. You know, as you well know, with all the meetings that you attend, you just can't attend everything. And so Morrison County's been a little bit criticized for our lack of participation in the Rum River Watershed One Plan, One Watershed effort. They've been meeting for over a year and a half. They've come up with quite a lot of good information. Their TMDL and their RAPS plan are completed, but now they're encouraged by the Board of Water and Soil Resources to apply for the funding to do One Plan, One Watershed. Morrison County makes up about 8% of the Rum River watershed, but we do indeed have quite a few feedlot issues over on that area, and we have projects that will certainly qualify for funding. I have read their minutes. I've always kept up and commented on their whole planning process. I have not attended their meetings, so they're reading that as we don't have an interest. This resolution and the presentation this morning is to say we indeed have an interest. We just realize we're a small part of the watershed, and we may or may not have time to attend the minutes or the meetings. But what they're looking for is a declaration from the Soil and Water that yes, we are indeed interested and we will work with you on those concerns that affect properties in Morrison County. And then further, they would like to know of a county board or a county appointed representative from the county to also serve on that. I think in the other counties that is a commissioner. It doesn't mean you can't delegate it to someone else if you choose to do that. And then I will attempt, or my replacement will attempt, to try to start supporting them in a more meaningful way, but it's just tough to be in meetings every single day of the month and try to get something done besides, so you have to kind of pick and choose your battles. But that's what this whole plan is about. They're doing a very good job. The Rum River is a total maximum daily load river. It's a beautiful resource for the state of Minnesota. So I encourage that we support their efforts and say, yes, we will indeed be supportive. And if you could name a county representative that would be the point of contact. It doesn't mean you have to attend their meetings, but it would be their point of contact. And of course, the Rum River watershed in Morrison County takes in a portion of Commissioner Mike Wilson's area and a portion of Commissioner Wincher's area.
We can certainly talk about that, and I'm not so positive that both of them wouldn't want a tag team on it.
Yeah, I'm interested in being part of it.
Yeah.
And I love how you put that, Helen. You put it very clearly. They obviously don't know you very well, because if they did, they would know that you're on top of all of this stuff, even though you haven't been at their meetings on a regular basis.
Well, as you know, the state is really pushing one watershed, one plan, and the plan that you just approved in 2017, we broke it down by the watersheds. We call it one plan, 5 watersheds, and we included the Rum River
Absolutely.
piece in there. And so it's not that we've ignored them. They reviewed it. All of these people know me. They just also know that Morrison County has 5 major watersheds. It's impossible to try to, and I've said this to Bowser, do you want us out there doing, or do you want us indoors planning? I mean, I don't know what one watershed, one plan will mean as far as what we need to do, any more than our local water plan defines as well. In my mind, it's a duplication of effort, but younger people, newer initiatives, they see this differently. What Bowser has said to me when I've challenged them on this very thing, and I challenged the Bowser board on it, is that central Minnesota is unique. We've worked with Mille Lacs and our surrounding counties for years and years and years. You know, the Little Rock is a bigger effort, but we worked with Todd and Crow Wing and Cass and Wadena counties for a long time on the Long River, or Long Prairie River. We've always been involved with the efforts in a watershed fashion. That's not news. But when I challenged it, Bowser said to me that that's unique to central Minnesota. Not all of the other areas of the state are watershed planning. So there's going to be 5 of these teams in the future. The Soil and Water, the county will have to be somewhat involved in the process in order to be eligible for future funding.
So would it
And
make
that's when
sense,
I get
Helen,
more interested.
that we have someone from our board there, or, and I'm going to point the finger back at you and point it right back at me, it's fine, to appoint someone from Soil and Water to actually be the person?
That will automatically fall on me or my replacement. But if we have a county rep and they know the point of contact for the Soil and Water is the manager or the water plan coordinator, so
Okay.
we'll automatically express that, yes, we will indeed be involved in it. It just may be from a remote site. I mean, I can't commit to go to all of their meetings.
No, I understand.
If I may, Mr. Chair, Helen, I know your plate is full. And again, will this affect you as far as your work capability if we approve this resolution, which I'm for it? But again, you know, you've got the Mississippi. I know you've had challenges on there, the Platte River, you know, all these things. So if we have this resolution, are they going to say, you know what, can you get me a grant for this, or can you do that? Will that have any
No,
effect
but
on
this leverages, when they show full county support from all counties in the Rum River watershed, it leverages their ability to apply for funds for the watershed, in which case Morrison would be eligible for a piece of that. If we have a project, these funds go to the project, and if that's in Morrison County, we'll get it. But if you fail to have shown support for their whole plan, then we're somewhat ineligible. No, they're not going to be asking the county for funds. It's leveraging money from the state to address the watershed issues, and then Morrison would be eligible for a piece of that funding.
Thank you.
I'd be happy to be a contact person if you want to be also.
Yeah, we
so
could, you know.
You can give them our names and,
All right. Well, why don't we, in addition to supporting the resolution, perhaps identify you as committee members on the.
It's asking for contact information.
Right.
That's
they're-
really what it
they're
is.
purely looking, I
Oh,
can
so
give
it's not
them
a
that.
formal board or anything that needs to vote, that we should appoint them in our minutes?
I think you should just appoint them in your minutes and then also approve the resolution, get those 2 things back to me, and then I will forward it to the chairman of that committee.
So
As
Helen,
That's who will be representing Morrison County.
for conversation pieces, Soil and Water still will attend when they can,
Yes,
and a Morrison County commissioner, if you will, when they can, they would also attend?
Yes.
That's what you're saying?
yes.
Okay. Does that work for?
Yeah, and I think
Either or
just give,
both of
you know,
you?
our contact, you know, our emails or whatever.
I still think it's a good idea to be able to put you on the committee list because that's going to be a committee where you're representing the county. So in
Totally
addition
agree.
to supporting the resolution, I would suggest that you identify Commissioner Wilson and Commissioner Winter as co-committee members for the Rum River watershed, and we'll identify that.
I'll make a motion to that.
Second.
Got a motion before us to support the resolution and to support Commissioner Wincher and Commissioner Wilson to be part of the Rum River Watershed District on a committee, if you will. Discussion? Those in favor?
Aye.
Opposed? That motion passes.
And Mr. Chair, I'd always suggest to, don't forget that we have Galen Gruber hired as a shoreline specialist who understands water and how it flows and whatnot. And so if you have any, point that you think it would be good to include any staff, certainly reach out to Amy and we can help support that effort if you find it necessary.
And Helen, thank you for bringing this forth because I understand the whole group is much better than one person trying to go after something. But when you have the whole group, if you will, and I get it, you got to participate in some way, shape, or form. So thank you very much for that.
You bet. Thank you.
Thanks, Helen.
Thanks, Al. Does
We'll
that
see
take
you
a roll
shortly
call
without
vote?
your
It's just that
tie.
it shows
All
it
right.
on here?
I don't know. It does not take a roll call vote.
Okay. It just shows the thing down there?
Yeah, that's, yeah.
okay.
That's just for minute taking.
Our next item of business this morning is the sheriff's report. I see Sheriff Larson is with us. Good morning, Sheriff.
Is that a different email? Is that a different email?
Yeah. It came this morning, I think.
So,
Morning, members of the board.
Good morning again, Sheriff.
Did you guys get it?
Yep.
Yeah, we have it, yep. Yeah, he sent it out.
So I got the May monthly report, and it's been busy. Memorial weekend, we started our boat and water. So we do that boat and water patrol every weekend from Memorial weekend through Labor Day weekend. And usually it's Friday evening, Saturday, Sunday, then of course any holiday in between. And we're trying to hit all the lakes in Morrison County, and we usually coordinate with the DNR, just because if they're on the same lake, we'll call beforehand, figure out where they're at, and try and hit a separate lake so we can just enforce as many lakes as possible. So the first picture, as always, I always kind of steal some photos from our social media page. The first one's called Hooked on Fishing Event, so it's hooked on fishing, not drugs. And this was a group of fourth graders from the Staples Motley School that we were able to have contact with. And I don't remember exactly how many kids showed up, but there was quite a bit. And then they kind of put them in teams of 3, sometimes 5, and then they go into a boat with some mentors and take off fishing. So it was a great event, just showing some photos how our office participated. We actually used our Morrison County boat and water patrol boat on Lake Chaminade, threw some of the kids in, and just good to see some smiles on their face. Next picture, just showing Deputy Bill Vandenhoven. Our office has been pretty proactive. This is something he wasn't even told to do. He was just doing a walkthrough in the school and said, hey, do you mind if I read a book to the kids? So still involved in the schools. Obviously now they're on summer break, but just showing that we're still involved at every age in the school. This particular case was Upsala School, and it was a first grade classroom. So we had our annual sandbox fill on May 25th, 2018. We filled 47 sandboxes, and that was all in the Little Falls area. We collected 300 pounds worth of non-perishable food items, and I believe we received $60 in cash. So always a good program. On the photo, we had our jail programmer, Tim Brummer, our correctional officer, or I'm sorry, Sergeant Kerry Herman, correctional officer, our STS crew leader, Kim Lillamo, and then correctional officer Doug Rocco. They were all involved with this. So it was a good event. This is just a picture. We had National Correctional Officer Week in the week of May. And of course, we just grabbed some of the staff members that were present, took a quick photo, but you know, as a sheriff, there's so many things that can go wrong. And obviously in the jail, to me, it's almost the greatest liability you can think of. Day in, day out, there's so many things that happen on a daily basis. So we got to have the proper management and the proper correctional officers to be able to attend to all these different needs that take place. So it was good just to recognize some of our staff, but obviously our entire staff, day in, day out, do a tremendous job. So we took that little photo and threw that on our social media page as well. And again, it was just a correctional officer week, so that's the photo we captured. We'll skip this page. I'm going to talk a little bit about our drug investigations later towards the end. I guess I will highlight the bottom of that page, that we had 22 officers attended the Firearms Training, which was a rifle zero. So this month, we're doing Handgun Qualification and Rifle Qualification. So it's mandated by the state that we qualify with every weapon that we carry. So usually what we do is we make sure a month prior to the qualification, guys are bringing their rifles to the range. We're getting our actual zero, making sure that everything's good before we actually qualify. So that's what that means, zeroing. Other than that, we had 3 officers attend Minsani, which is a drug investigative training, and then we had 1 officer attend a taser refresher training. So our number of criminal complaints, we had 215 for the month of May. And I'll just highlight kind of the biggest ones here. So in the purple shade, which would be your 3 o'clock position, it's 5%. We had 11 11 incidents, ICRs, which are incident crime reports, for under 18 alcohol. But that can be somewhat deceiving because there might be 1 incident report, but that 1 incident report might include multiple people that were cited. So in this particular case, there was 11 incident reports. However, there were 26 citations that were issued to minors who were under the age of 18 for alcohol. A majority of those occurred at Mudfest.
If I may, Mr. Chair, when somebody gets a minor consumption, there's got to be an adult called or something like that. Can you explain what?
Yeah, so what happens is if we can prove that there was somebody drinking who's underage, if they're 18 or older, they're an adult, which means they can be released. Someone obviously needs to come and pick them up, or if they're staying overnight somewhere, we usually leave them be unless it's to the point where they need to go to detox or they need somebody there. But if they are 17 or younger, we are contacting a parent or a legal guardian, and we will hold on to them and secure them until that person actually comes and picks them up. Or sometimes we'll transport them to the sheriff's office, depending on where we're at, and they will stay in our custody, I guess, until that parent or legal guardian picks them up.
So Sheriff, what do you do with that juvenile? I don't believe you can throw that juvenile in jail, behind bars, if you will. So what happens with them?
So what we do is we do a long form complaint with all the indicators as far as what occurred, what our probable cause was to actually be there, and what we witnessed. Normally we have them submit to a preliminary breath test. It's called the PBT. And with all the indicators that we observe and the tests that we take, we'll do a long form report and we'll send up to the county attorney's office.
So what happens with that juvenile when you bring that juvenile to the sheriff's office? Do you have a special room to put them in?
We have a juvenile room, which we call a juvenile detention room, which is a secure room. They'll stay in that room until the parent or guardian arrives.
Very good, thank you.
Yep. So moving down underneath the 5%, there's a blue shade. 28%, it's in the right bottom quadrant, and that 28% is the 18 to 21-year-old alcohol citations, and for that we had 60 incident reports, but out of that 60 incident reports, we had 77 total citations. So again, it gets kind of confusing. Let's say we ended, a majority of those are from Mudfest, but let's say we went to another juvenile party out in the county somewhere. it's going to be one complaint, but it's going to be multiple citations on that complaint. Other than that, I'll just highlight the 18%, which is the left bottom quadrant. It's a blue shade. That's our damage to property. We had 19. Oh, I'm sorry, we had 38 incidents. But that included private property as well as a couple businesses and a couple public businesses. And then our thefts, that's the kind of the pink shade, which is the 9% in the top left quadrant. We had 19 thefts. And of course, some of those include gas drive-offs, so some of the numbers sometimes can be deceiving because that's how it gets reported as a theft. But in actuality, sometimes by following up, we're able to figure out who the registered owner was, who the driver was, and then they do eventually make payment. So, any questions on any of that?
Sheriff, I wonder if you can go back in time for just a second. I do have a question in regards to officers attending trainer refresher, taser in refresher training. Sorry about that.
That's all right.
How often does that happen?
So we have
I know you've got 1 to 21 sworn officers. I know you are 1 to 31, 41, whatever the numbers are. Sworn officers, you also carry tasers up in the jail, and I know that you can't recertify every day on everything that you do. How often does one have to, or how often does one get recertified on a taser?
So on the taser, we have to get recertified annually. So once a year, it's part of our checkoff list that needs to be completed. And that usually means going through multiple scenarios, deploying X amount of taser cartridges, and making sure that we're taking a test and we're remembering the different things that are required to remember.
So in this case, it was an instructor refresher, so you have at least one instructor on your team?
Correct. So for the sheriff's office portion of it, we have one taser instructor, but then we recently sent a correctional officer from the jail to go to taser training as well. So that person will take care of the jail training.
Thank
for
you.
taser.
Thank you very much. Sorry for the interruption.
So then the next page is just our traffic citations. And again, we had Mudfest going on, so that's going to bring up some of our activity as well. We had 46 citations for speed. That's the 16%, kind of the red or burgundy color on the top. The bottom orange was 59%. That was 166 verbal warnings that were issued. And then the left top quadrant, the shade of blue, is 15%. That was 42 written warnings that were issued. So moving on, if you look at our 2-year comparison, you'll notice that everything's pretty much gone up except for our drug investigations, which have gone down a little bit, which I'll discuss as far as why those numbers are down. And then our total inmates down just a few as well. So it's been a busy month. As far as our inmate count, Morrison County, we averaged 37 inmates. Itasca County, we've been averaging 17 for the month of May, and then Stearns County, we had 1 for the average. Our total population, including all the counties, including Morrison and the different counties we housed, the average was 56. Our sentences served, it's been a while since since I talked about what they've been up to. They've been busy, and as you imagine with spring, there's been a lot of projects for spring cleanup. So they've been involved pretty much all over the county. They helped out with the fairgrounds, setting up for the 2-cylinder club. They've been at the Piers Golf Course, and this is all pretty much cleanup. Calvary Cemetery, St. John's Lutheran Church in Buckman, Cedar Lake Memorial Park, Flinsburg Ballpark, Rake and Leaves, the Randall Park, Camp Ripley, Crane Meadows. So they've been very active, and we've been getting a lot of positive feedback from the community and people in charge of these different parks and stuff saying, advising us about the good work they're doing, so that's good. Other than that, I'll highlight the out-of-county inmates. We had 43 for the month of May, and we brought in revenue of $31,405. So what I did was I got a printout about a week ago as far as where we're at to date. So from January of 2018 through the month of May, we've collected $128,040 in revenue for our jail. Any questions on the report, and then I'll just kind of move on to what's been going on in the drug world. Oh, okay. So we're working a major case right now, which I'm not going to get into detail, but it's out of our home area. But we're assigned to the task force, so depending on what's going on and what the needs are, most of our personnel has been shifted. And the reason for it is because it's a large-scale case, and this case is pretty much 24 hours a day. It started May 3rd, and it went through June 3rd, and now they're going to be picking back up again. So it's involving pounds and pounds of drugs, which I'm not even going to go into the type of drug. But I can tell you this, these are people that are pushing drugs that eventually come our way and cross our county lines. So it is important, especially for these long-term investigations that we're involved, because at some point, it's going to have a positive impact on our county if we can stop the flow of drugs and apprehend these people. So our guys have been really, really busy, which means when they're working 24/7, they're on call, they're working any and all hours of the night. There's still activity that comes up here that we're not ignoring, but their priority is to get these big drug dealers pushing all this dope off the street, which eventually is obviously going to affect our own county. So that's kind of why the stats have been down a little bit regarding May, but they've been very busy. So any questions at all for me?
I think you're good, Sheriff.
All right, thank you much.
Thank you very kindly for your time. Social Services is next. And this morning, we're graced with Brad and Cindy.
Good morning, Mr. Chair, Commissioners.
Good morning.
Good morning.
So this morning, we are going to share information on one of our financial assistance teams. That's the long-term care unit. And so Cindy has put together a report for the board to share what's been going on with their unit.
As you can see in the first slide, this encompasses all programs that the long-term care team work with. And you can see that we've had a steady increase in the amount of applications across the board. There were a couple months that maybe were a little lower, but overall, we've increased over the last 3 years.
Can you say what those programs are at the top?
Sure. Minnesota Supplemental Assistance, Group Residential Housing, General Assistance, Supplemental Nutrition Assistance Program, and the Long-Term Care and/or Medical Assistance. Average applications taken per month, you can see a steady increase in that as well. There's a 30% increase from 2017 to 2018 in applications, but if you look from 2015 to 2018, it's a 68% increase. And then I just highlighted applications quarterly there for you as well.
Mr. Chair, Cindy, can you talk a little bit about thoughts as to why?
Truly, I think it's more the baby boomers. A lot of it is the medical assistance and long-term care waivers, which still fall under long-term care, that, people being taken care of in their home, but
Okay,
we need to pay someone for doing that.
That was my guess, and I was going to assume it would be just aging demographics. We've talked a lot about how that will impact the services we provide, and this is one very clear example of that.
And it's going to continue because
Yep.
more and more of us are getting up there.
Speak for yourself. Yeah, there are really two factors, the aging population, but also the fact that the state has opened the waiver programs, the CADI waiver, Community Assistance for Disabled Individuals, and the Developmental Disability Waiver. So those all go through most of those go through the long-term care unit as well. And so those with a disability are more apt to receive services through a waiver now as well, so.
The only waivers that don't go through long-term care would be for minor children.
Yeah.
Excuse me. The average applications and ADAPROG. So that ADAPROG is if we already have someone on medical assistance and now they want to add food support, That would be what we consider adding a program, but it gets counted as an application because that's how the state registers it. It's a whole new app, and it is a new interview as well. So you can see that that's increased quite a bit as well. To do 15 applications per worker per month is a ton, especially if the majority of them are the long-term care applications, because those can be so encompassing, so much information, and, assets and such need to be looked over and determined whether they're countable or not. So truly, you can spend 8 hours on one application, sometimes more. Number of documents processed. As you know, we have an EDMS, the electronic data imaging system, and we're able to then count all the documents received into each department within social services. And you can see over the 4 years the number that have been completed. For 2015, with only 5 months of the year done, we're already at the 4687. So I presume it'll be higher than the 2016 amount by the end of the year. I just gave you a graph showing the amount of phone calls taken per month as well. And then last time I had shown you how many people were on Medicare savings within Morrison County, and that's a program where we pay their Medicare premium for them. The last report in 2017, there were 668 persons on. Now there are 727, so that's an increase of 59 people.
So what's the benefit of being on this program, Cindy?
Well, like I said, it pays for their Medicare premium, and also there's different MSP programs, the Medicare Savings Programs. There's one called QMB, Qualified Medical Beneficiary. That's where we pay their premium, but also there's co-pays a lot of times that go with Medicare. QMB will cover those co-pays. The Service Limited Medical Beneficiary, we pay their premium as well, and then there are a few co-pays that get covered, but no in-home care or anything through that. And then QI1 is another program, and that strictly just pays the premium.
But the 727 is just the total of everybody, or the 727 signifies we pay what?
Well, it varies, but the average Medicare premium per person is about $105. But it can be a little less than that and can be a little more.
And that would represent that 727, those people.
Correct.
Thank you.
And Mr. Chair, those dollars to pay those premiums come from federal programs that we access and are kind of that gatekeeper for.
Okay. Very good. Thank you.
Then active group residential housing cases, you can see that has been a steady increase over the years. In 2017, there were 175, and now we have 199, so that's a 24% increase really in just 5 months. And an 85 case increase from 2016 to 2018. The group residential housing, that is where we pay for people in like Highland Senior Living, Diamond Willow, Newest Center. We pay for their room and board. Also, it can be too where we use supportive housing monies, and that's where if people are living on their own and their rent is more than 40% of their income, they can qualify for a supportive housing grant. It was $194, and as of July 1st, it went down to $192.
Mr. Chair, is this a type of system in which there are so many dollars that Morrison County residents have access to, or is it if you qualify based upon the parameters that are set within the program, you will be able to access funds regardless of how many others do?
Correct.
Okay, so it's not limited that we're defining that. And those are all rules set forth from the federal government about who qualifies. We don't get to make that decision as identify the specific residents who qualify for that. We don't set the parameters.
Correct. The only one that is state-run is the Minnesota Supplemental
Okay.
Assistance Program, and that's where if they're receiving SSI, not RSDI, but SSI, they can receive an additional $81, excuse me, in a cash grant. But then, too, if they're on a special diet, and there's a list of, I believe it's 11 specific diets, they need to have a doctor form verifying that they are on one of these 11 diets, and then that would increase the amount of cash they get per month.
And with group residential housing, it doesn't matter if you live in Morrison, Hennepin, or Koochiching County, you're going to get the same benefit set. So it isn't like anybody's coming to Morrison County because we pay more for their housing. So it's the same across the state. All depends on where there's a bed available for some of these folks.
Exactly. And along with that, there are times that we have clients in other counties, and they service the case, but we're paying the bill, and vice versa. And then
If I may, Mr. Chair, when you say we're paying the bill, is that the federal government or is that the county?
Federal government in most scenarios.
Right. I just wanted to clarify
Yep.
that out.
Then I just included some information. I don't know if you had a chance to read it over. If you'd like me to go through it, this is what I was talking about with the Minnesota Supplemental Aid. That would be that $81 cash grant. I did include also some long-term care and why it matters information. And I'd like to go to the last page and just share with you where I enclosed a little information from DHS, where it says family and close friends provide the majority of long-term care, and when they are unable to provide care, they turn to local community-based programs, home care agencies, assisted living facilities, and nursing homes. Many people receive care at home from a combination of family, friends, volunteers, and paid caregivers. Across Minnesota's 87 counties, the percentage of the population with a disability varies. Because disability is strongly associated with aging, counties with higher percentages of older adults have higher percentages of residents reporting disabilities. More than 7 times as many persons with disabilities, about 110,000, live in Hennepin County alone, and the county with the largest number. Morrison County had 4,090 persons as of 2015 that fall under that category. Then a fact from the Department of Human Services, 70% of those over age 65 will need long-term care at some point in their lives, and 40% of all long-term care is provided to persons under age 65. So I thought those were some interesting statistics where a lot of times it's children with disabilities, they come on at birth and they never go off, or sometimes it's due to injuries and accidents.
If I may again, it seems though like Morrison County has a higher percentage. If you look at if there's 110,000 in Hennepin County, they're well over 1 million.
Correct.
And we're about 30,000, and we have. So what do we have a reason why that is?
I'm sure there is one. I don't know the answer, though.
That's good.
It goes back to what she said, is we're all getting older.
Yeah. Well, they're getting older all over the state, though.
True, but a lot of times the population, if we have an older population within Morrison County, then that can reflect it as well.
And I think we tend to see the younger population move to more metro areas, and their parents stay back in this community or where they're from. And so that outer migration of Morrison County into the metro, I think, has an impact on that percentage as well.
Mr. Chair, if I could ask a question, your caseloads or your applications have grown by 68% in the last few years. I know your staff level hasn't grown by 68% in the last few years. What type of things have you done to combat that or to manage that, Cindy?
Well, the biggest thing is, case banking, which was implemented a while ago, and we were fortunate enough to get one more worker, so that has helped dramatically. And we break things down into what we're going to do each week, what we need to concentrate on to be within timelines for DHS. So we meet every Tuesday morning for at least 15 minutes and decide, okay, what's the priority for the week, so that we are getting applications processed timely, getting people on assistance, or getting in the information that we need so we can make those determinations.
Yeah, I just wanted to highlight that. There's been a number of different things that they've deployed to be able to really manage some of those increases. We're going to continue to see this as an area that's stressed when it comes to that aging population and continuing to manage, being creative and being and making those adjustments and whatnot. That's appreciated because it is a lot when we see those numbers increase like they are.
And again, yeah, staff have done a great job. Cindy and Karen with their staff have done a great job making sure that they get their work done. And I think, things ebb and flow, so there are slower times, but then there are those peaks. And I think how Cindy has implemented that with staff in terms of let's plan for this week, let's plan for, I think has really helped. I know initially, about 4 years ago, we were out almost to 60 days, and they've significantly trimmed that back to 20 to 30 days, depending upon if we get the information. A lot of times people will put in the applications and there's a lot of information they have to provide. Assets, houses, cars, tractor, whatever the case might be in terms of assets. And so staff are having to follow up with applicants from time to time, sometimes a lot.
A lot of times information will trickle in. We'll send out a memo and ask for, 9 items, and we might get 3, and then we might get another 1, and then we'll make a request and give them another 10 days to get in the rest of the information. But what Brad said with being within 20 or 30 days, we have been meeting DHS time guidelines for the last at least 6 months. We've been under that timeline. Other than, a few cases where there's special circumstances where we've either allowed them extra time or they've had an issue obtaining information. Sometimes getting life insurance information can be really hard for clients. Sometimes, they're requesting it. We will make a request. They'll have a guardian that's working on it. For whatever reason, it's difficult sometimes. But I wanted to say, too, on a little bit of a different note, if you look at the caseload size, I believe the last time I checked, it was 856 cases for 4 workers, which doesn't sound like that much. But when you're working with this clientele, we have people that are passing away and dropping off that caseload all the time and new clients coming on. So the processing of applications is still, it's not necessarily reflective with that 856. They're very busy is what I'm trying to get across.
Yeah.
So there's no shortage of work.
Thank you.
Mr. Chair, may I ask a question?
Yes, absolutely.
You said you implemented case banking. Could you give a brief description on what case banking is?
First, I want to clarify, I didn't implement it. It was the supervisor prior to me, Corinne Bjork. But how that works is any paperwork that comes in goes into a pool, and through our electronic data system, we pull paperwork in date order received. So whoever gets in their stuff first is going to get worked on first. So no case belongs to any one person. It belongs to a unit. We have a long-term care unit, we have a health care unit, and then we have what we call the eligibility team. The eligibility team is Karen's, and that is where everything to do with family and foster care and adoption assistance, all of that is in with Karen's unit. But again, they work the same way, pulling things in date order.
This was a process that was implemented counties started about 8 to 10 years ago, and some counties have jumped on, some counties have not. But really, I think the benefit of case banking is that no matter who you are, benefits are provided at the same time. It isn't based on individual workers. And so the deficit is, of course, somebody who is trying to get information may have to talk to more than one person. They call today, they may get Cindy. If they call tomorrow, they may get me. So sometimes that can be frustrating, but I think the benefit is benefits go out at the same time for everybody, irregardless of who you are, as well as the ability to just shift work amongst the unit to make sure we're working efficiently. So,
Correct.
Mr. Chair?
Yes.
Brad, all this money here that comes from federal and state, this is part of that $85 million approximately that comes to the county to go to programs like this, which benefits our areas with nursing homes and elderly care, and that costs our taxpayers about $3 million to administer this. Is that correct?
that is correct. This is a part of that formula.
In it costs taxpayers in property tax that they pay to the county, yes.
Yep.
Yep.
Very good, Cindy. Thank you very, very much.
Thank you.
Thank you.
All right, at this time, I have a public health report with Sarah Pratt, who's going to provide information on the State Health Improvement Program.
Good morning, Sarah.
So, this is the first time I believe you all have heard about this program, correct me if I'm wrong. So,
Pretty sure, yes.
So the statewide health improvement program started in 2009. It's a local public health grant received from the Minnesota Department of Health. The state of Minnesota's health department modeled this program after Steps to a Healthier U.S., a federally funded health promotion program. SHIP builds the capacity of local public health through community partnerships, along with funding opportunities to move toward creating sustainable policy, system, and environmental change. So the purpose of this program is to improve the health of all Minnesotans and thereby decrease healthcare costs through increased physical activity, healthier eating, and less use and exposure to commercial tobacco products. SHIP succeeds by encouraging and supporting healthy living and addressing health disparities through community engagement, local decision-making, and sustainable evidence-based strategies. So Morrison, Todd, and Wadena, all public health agencies, have been working collaboratively to reduce obesity and tobacco use and exposure in central Minnesota. So again, the goal of the program is to create healthier communities across Minnesota by expanding opportunities for active living, healthy eating, tobacco-free living. It's created by making this healthy choice the easy choice where we live, work, learn, and play. So improving healthy outcomes requires strong private-public partnerships. SHIP's model is grounded in developing strong partnerships across numerous sectors. So that arrow just kind of shows the progression of what our goal, and that is increase opportunities for physical activity, nutritious food, and tobacco-free living, which means more people get physical activity, better nutrition, less tobacco, which leads to improved health, which lowers healthcare costs and improves quality of life. So the key model that SHIP is based on is the socio-ecological model, which places emphasis on the importance of the social and built environments that shape health throughout the life cycle, as well as highlights the linkages and relationships between multiple factors that affect health. SHIP primarily is focused on the outer three layers, which is organizational, community, and public policy. The SHIP model addresses two risk factors, again, obesity and commercial tobacco use exposure along four settings: in your communities, in your schools, in your workplace, and in healthcare. So one of the outcomes of SHIP work that will have the highest impact is to improve health equity. To make health equity possible, all strategy work will be addressed in a triple aim approach, which is that little triangle there. So the yellow is implement a health and all policies approach with health equity as the goal. The red is expand our understanding of what creates health. And then the blue is strengthen the capacity of communities to create their own healthy future.
As you might remember, a couple years ago, the Minnesota Department of Health was pretty big on implementing health in all policies. There's quite a large document provided by the Minnesota Department of Health around implementing health in all policies. And I think counties, the state, are in different positions around that at different stages. And, part of the work of SHIP is to, as a community, is to think about those things. We've talked about it before in terms of tobacco use within the government center and outside the government center. And as kind of an example. And now with obesity, trying to figure out how we can manage obesity across all of our sectors, and so they've been working pretty hard at it. So,
for some reason, I printed off a black and white copy, which is not helping me right now. So, SHIP focuses on policy, systems, and environmental changes. So we really want to make changes, not in regard to the policy, the organization, and our community. So evidence-based strategies with proven effectiveness coupled with strong evaluation procedures are utilized to increase opportunities for physical activity, nutritious food consumption, and tobacco-free living, with the short-term goals of improved nutrition, increased physical activity, and then reduce overall tobacco use, and then your intermediate goals of reduced obesity and tobacco use and exposure with long-term effects of reduced chronic disease and healthcare costs. So the interventions included in SHIP are intended to encourage public health efforts in Minnesota to move away from an emphasis on programs and move towards a focus on implementing policy systems and environmental change. So what that chart shows is what policy systems and environmental change means. So the first side is individual change efforts, and then the other side is PSC approaches. So temporary behavior change, where PSC looks at social norm changes. Individual change is unevenly applied to select individuals or populations. PSC focuses on supports foundation of individual behavior change. Individual change can be inequitable. PSC change is widespread population impact. Individual change is expensive. PSC change is sustainable. Individual change is time constrained, where PSC is long-term. So again, it increases the ability for these changes to make a bigger impact across populations and be sustainable. So the next part is just showing, again, what policy change is. Policy change is hopefully enforcing existing, changing ordinances, making new laws and mandates and that foster health. Systems changes are changes that impact all elements of an organization, institution, or system, such as schools, transportation, parks, and recreation, really trying to make systems changes in those areas. Environmental change is involving physical or material changes to the economic, social, or physical environment, like incorporating sidewalks, paths, and recreation areas into community design, offering healthy snack and beverage options, and school vending machines. Those are examples of those kind of changes. So this little fun equation shows how our funding is, how we get our funding. So again, we are included in a community health board with Todd and Wadena County called Health for Life. The Minnesota Department of Health provided SHIP funding across all 3 counties for a 5-year grant. Our current grant cycle is November 1st of 2015 to October 31st of 2020. So SHIP funding is allocated across the state of Minnesota based on a 3-tier cycle. What tier a county or CHB is based on is on the below formula. So we get a $1,000 base, and then a $10,000 collaboration incentive if you're combining with agencies outside of our CHB, which we do not. So you can see the second equation shows we do not get that money. And then per capita funding times your total population equals your total funding amount. So the bottom shows what we have for this year. $1,000 base.
$100,000 base?
Yeah, $100,000 base, thank you. No collaboration. 2 per capita is 167 times total population. We had a $25,755.70 carryover, and that was for our HEDA, which I'll explain later. We got money specifically to a HEDA project, and our CHB was a little slow on getting going on that, so we had that carryover, which I will explain later what that project was, but we were able to do that this year. So our total funding is I hate numbers. $244,493.70. So
You're a social worker, Sarah. That's
I know.
okay.
It comes out in things like this, doesn't it? And so that is the pie chart of the 3 counties and how we allocate the SHIP money. So more.
I was just going to say, so part of the factors in this funding formula depends on our staff costs, who's a part of the SHIP program within each agency. And so, for instance, Sarah's in this formula. I'm not. In Wadena County, the director's in the formula. They don't have somebody else in the formula. We do a little bit more of the accounting. So we try to base our financial formulas on the work that we do. And so, and the 3 directors really, more so the 3 financial accounting staff in each county help to create this formula, make sure we're all equitable in what we receive in the work that we do.
So the tier placement not only determines funding, but also the number of strategies that we are to work on. So Morrison, Todd, Wadena is considered tier 2, which means we're required to work on 4 strategies in 4 settings across 3 behavior areas. So our strategies are specific activities one or more counties are working on to produce that PSE change. Our settings are, again, healthcare, schools, work sites, and community. And our behaviors are tobacco use, physical activity, and nutrition. The Tier 2 funding grantees are required to meet with a community leadership team regularly. The purpose of the leadership team is to establish and grow community support for policy systems and environmental change work in obesity and tobacco prevention. Additionally, to support our mission of building a healthy community together to reduce healthcare costs, create sustainable solutions, and meet local needs.
And for us, our community leadership team is our Public Health Advisory Committee. And so Emily and Sarah will come to our Community Health Advisory Committee on once or twice a quarter, or once a quarter really, to share the data, get some input, get some feedback. So for tobacco, we worked with Royalton Schools actually in their health class to get some data on tobacco use within the Royalton School. So we'll bring that information back to the Public Health Advisory Committee.
So SHIP has been instrumental in helping Minnesota keep obesity rates relatively flat and reducing tobacco use and secondhand smoke, factors that contribute to chronic diseases, rising healthcare costs, disability, and death. So I just threw in a few graphs of where we're at across the 3 counties. The first one is our obesity rates, our overweight rates. As you can tell, we have 31% in Morrison County of obesity. This information was from 2016. And then the second graph is, 1 out of 4 adults eat the daily requirements of fruits and vegetables. So we showed how many adults are eating how many servings of fruits and vegetables. And then the third chart is our current tobacco use. So we've talked about this a lot with some of you regarding youth tobacco use is on the rise for the first time in 17 years, nearly a 50% increase since 2014 due to the explosion of the e-cigarette use. So nearly 1 in 5 high school students report using e-cigarettes in the past 30 days. So
one of the things we talked about at our CHB meeting, and Commissioner Wilson and Commissioner Blaine may remember this, is that we're going to, actually at a planning meeting, have Catherine from Todd County, Sarah, other staff talk about the increase in cigarette smoke and what is causing that. And I think Commissioner Wincher was at our meeting in Staples or Wadena, where they gave quite a presentation on all of the e-cigarettes, the vaping, kind of all the products that are really targeted towards youth these days. And that's part of the reason why smoking is increasing, is how now they're targeting kids with these various electronic devices that is not technically considered smoking yet.
Those e-cigarettes were amazing to me because, I mean, the technology, I think some of them had the internet on them. And,
Yep.
I mean, they ranged anywhere from like $10 to like $300 to $500 for a darn one of these. It's like, they're just amazing how.
So we thought it'd be good to bring that presentation to each of our county boards, and so we're going to do that at one of our planning meetings, is bring that presentation forward to all 5 commissioners. So.
Yeah, it's just about the aggressive marketing with these kids and the easy access. You can, put a date of birth that you're 18 and have this delivered to your mailbox. So, it's just aggressive marketing, and it's causing an increase in use. So I wanted to put a little bit about what does Morrison County do? What does all this mean? And, what kind of work are we doing, and what kind of changes have we made? So in regards to our community nutrition, we have our One Vegetable, One Community project, which is a pilot project partnering with community sites to distribute seeds and educational materials through social media to community members. So we're focusing on beans. I don't know if you guys have seen any of that, or so we delivered seed packets to several distribution sites like the public library, schools, and those packets have seeds, growing instructions, nutrition facts, recipes. We put some information about this on our Morrison County Facebook page, and so people can share pictures of their growing beans, recipes, so.
I think we're up to about 900 packages that have been distributed across Morrison County.
I guess they're flying out of the library, and they can't even keep packets in there. For some reason, they're just flying out of there. So,
And that was, again, a partnership with some businesses who donated some of the seeds, and we purchased some with money available, and so it's been an interesting project, certainly, to see how quickly those packets have been accepted and taken. So we'll see if we get any results from that.
So then what is our PSE change is to increase access to healthy food, changes the environment, and providing education how to grow your own vegetable changes the system. So we wanted to show, how are we doing those PSE changes. And then we did the food shelf partnership, providing a training for staff that highlighted several strategies to increase healthy food access and use. Some examples include product placement on a produce stand, healthy food signage, motivational interviewing, and providing easy recipes. So those are some of the things that we have done around nutrition. Community tobacco, point of sale, assessing why types of tobacco products are being sold, for what price around the county, and analyzing location in relation to school parks and other places youth frequent, and the overall goal is to decrease youth access of tobacco products. I know Emily had just been out to a bunch of businesses with some minors to see if they would sell and try to, and she had brought this to the board, or Brad had, and this was more about a congratulate and educate. They didn't get fined for this, and I can't remember the statistics, but there was a few that did sell. And so they were appreciative of the opportunity to make some changes before the next round of point of sale audits. So in schools, we're offering annual trainings to teachers and other staff to increase activity in classrooms. Through bike rodeos, we provided education opportunities to be a safe pedestrian and encourage biking places like school. We partnered with school food services to provide taste tests of unique fruits and veggies to kids of all ages, and they tied that into Every Kid Healthy Week. And they had fun educational games about healthy food choices. Also assessed lunchrooms with a smarter lunchroom assessment to identify gaps and simple changes the school can make to make healthy choices in their lunch programs. Under work sites, we met with 5 Morrison County businesses over a year and provided expert speakers and tools to develop PSE changes in the following 5 focuses: breastfeeding support, healthy eating, physical activity, tobacco use, and stress management. Example is Royalton School District is supporting and encouraging mothers by providing a space and a written policy in regards to the breastfeeding. And healthcare, we're partnering with healthcare to conduct community health needs assessment, analyzing state of healthy behaviors. We did an I Can Prevent Diabetes education. And then this is where the HEDA comes in. The HEDA is a health equity data analysis survey with tobacco users with low socioeconomic status. So this is the project that Brad was talking about that we're going to present. This is the results that we gathered about tobacco use in the low-income population and what that looks like. And so our hope then is to use those results to make some changes of helping them quit, stress management, and all those sorts of things. So those presentations will be brought to you. And so looking ahead, some things we're looking at is we cannot easily pull data specific to our county because we work across the CHB. So our goal is to evaluate our strategy work locally so that we can easily share and measure successes that are directly impacting our community. For example, at the end of the summer, we were sending out evaluations for that One Vegetable, One Community project to see if our efforts increase healthy eating among families, the amount of time families are having meals together, and the amount of time spent outdoors versus screen time.
So there's a lot going on in the state health improvement world around the Community Health Board and public health, and And so these are some of the things that we'd like to start bringing to you in terms of information sharing. So
I know it's a lot of information, this is the first time you've heard about this, but it gives you a background of how it started, where we're at, what we're working on, and what we're hoping to do.
Very interesting, Sarah. Thank you. Thank you very much. Questions? Good. Thank you.
all right, and then I have liquor, Sunday liquor, and 2 a.m. liquor license renewal for the 12 Mile Tavern.
Look for a
Both
motion.
approved by the sheriff and county attorney.
So moved.
Second.
Got a motion and second. Discussion? Those in favor?
Aye.
Opposed? That motion passes.
Thank you. That's all I have this morning.
Thank you
Thank you.
very
Have a good
kindly,
day.
Brad. Becky is here this morning from Extension.
Good morning.
Good morning,
Morning,
Becky.
Just a couple of highlights I wanted to mention out of the board report. First of all, in May on the 17th, we did have Safety Day Camp. I'm very sad that I wasn't able to be there. My middle daughter graduated from Army Basic Training that day. But I did put a lot of people in places that apparently made the day very successful. We have been running right around 125 to 150 kids for a number of years now. I'm not sure if my letter was super engaging, but we had 350 kids and many more schools than we usually see there this year. So we did get additional presenters and do a little more extensive rotation in order to keep all of those kids busy, and there wasn't really any downtime. So I'm working on a report, and we'll get you a full report on how that day went and some fun pictures too. Summer programming, I am working on some babysitting workshops right now. We did have 4-H summer camp, and we're plowing into county fair in full force. We have much of the big items in place. All of our judges are secured. Premium books been out. 4-H registration is open. We're doing a new food stand online sign up this year with 4-H families. That's working very well for our major fundraiser. And the details are coming into place, looking for volunteers to assist with activities and ambassador promotion ideas, and we're into the paperwork stage. So that is going on wholeheartedly. Lots of other activities working in Extension, and I will mention that the Master Gardener bus is full, so there's only a waiting list left for that.
Excellent.
Wow. All it is, I have to say, comment, if you look at her schedule from upcoming events, your plate is full.
It's kind of insane.
Yeah.
Busy.
Yes.
Busy, busy, busy.
Yes, that summertime is the time for programming, and we're keeping those kids busy with lots of different activities and options going on. So a lot of that is also due to volunteers. I could not be every place at once, so there are a lot of volunteers that assist with that as well.
So our 4-H programs in Morrison County are doing well?
Yes, we are doing very well.
Excellent. Excellent. Very good. Gentlemen, questions?
Thank you for all
Thanks.
Thank you very, very kindly. I appreciate
Thank
it.
you. Have a great day.
Next on our agenda is county board warrants. I'd look for a motion to pay all of our bills. We have
So move.
Second.
discussion. Hearing none, this is a roll call vote. Commissioners Wilson,
Aye.
Lemire,
Aye.
Wincher,
Aye.
and myself as an aye. That motion passes. It's our county board warrants. Public Works report. Steve Bukowski is with us this morning. Good morning, Steve.
Morning.
Morning, Steve.
Just an update, that's all we got.
I didn't have any action items for you today, but I would like to schedule a Public Works Planning meeting for hopefully the middle towards the end of July, if there are some times available.
How about the 30th? Would that work for you guys? July?
That would work for me.
30th of July is on a Monday.
That work for you?
If that works for you, we can make that work. 8:30 at Public Works.
Sure.
May I ask a question? On the 24th, I don't have nothing on my calendar. That's a Tuesday. Are we missing?
We have a board.
Do we have a
County
board?
board.
Okay, it's not on my calendar. That's why I was wondering if there was one missing. Okay.
So we're on at 8:30 on July 30th.
Yep.
At Public Works. We
bet.
have canceled the solid waste meeting for July on the 5th, so that's in place. Just
The 6th is what he means, the 6th.
I'm sorry, on the 6th, yes. Friday the 6th. So just some quick updates on work that we're progressing with in the department. Our resurfacing work with Tri-City Paving, which was recently acquired by Knife River, is moving along pretty well out in the Sullivan Lake area. That work out there, we're finishing up pulling approaches. The paving is pretty much completed out there under the contract. We do have some maintenance paving that is going to be taking place. It'll probably be the first part of July that work gets completed. Out in Gutwall's Corner, and then also Little Rock to Royalton, paving is all completed out there. They're pulling approaches, taking care of driveways. We're also going to establish all the no passing zones, and then we'll follow up with the striping on those projects. Our main work on CASA 45 is progressing. The 2 miles from 46 or 43 to 46 are pretty much completed as far as the widening goes. We were going to move the contractor down on our CASA 12 for the bridge replacement over the Swan River. We were scheduled to start that on Monday. The rains that we had previously to that bumped the river up several feet. And so we delayed that. So he continued to the next segment on 45. He'll be working from Trunk Highway 27 to 43 over the next couple weeks. That'll open the next window where we'll try to do the bridge replacement on 12 when he gets close to completing that, as long as the river water elevations are adequate to begin that project. It's important at the start of one of these projects where we're going to be installing large culvert pipe that the river bypass and the protection of the work area, those need to start in a condition where the river is low. If we do get hit with some heavier rains, once that's been established, it's not such a big deal because those things are in place to handle it. But it's very difficult to build those when you're under high water elevation, and so that's why we delayed that. On the maintenance side, also the repairs on Pier 1 and Pier 2 that we have under contract with Eagle are scheduled to begin the first of week in July. So we're hoping that falls into place. That looks like that should happen at that point in time.
Steve, not to interrupt your train of thought, but if you take people off of the road work on 45 and move them to 12, if you do that, and you will, whatever, does work on 45 stop, or do they continue just at a slower pace?
It is possible that there could be some activity that takes place on 45, such as driveway pipe replacements, but it's going to be substantially less than what's going on there as far as the grade widening that's going on now.
Thank you.
On the maintenance side, then, the first round of mowing is going on right now. We'd expect the middle of next week that would be completed. We'll switch, once we complete that first round, the crews then move to these. We have probably a half dozen small communities that have events around the 4th of July. So then we focus around those small communities, make sure we have things mowed up and looking decent. There's a lot of parking kind of things that happen in these small communities that they're not used to. And so we do focus on that for a while, then we'll move over and finish the second round on the rest of the system. Calcium chloride placement is done. Crack sealing is completed for this season. We do and are continuing some of the Durapatch work, and that'll probably go for several more weeks before we have that where we are completed with it. Our own crews are doing symbol repainting, stop-aheads and railroad grade crossing markings on pavements. We are doing a replacement on the Sioux line today of a culvert, center line culvert failure out in the eastern part, just west of Hillman. And then the crews will move over to centerline culverts on our future work for 2019, prepping those and getting those ready for work for next year. Solid waste side, we have future cell construction on cell 6 that we're working on, along with we intend to conduct a final closure on a portion of cell 1 that we're working to put that project together. Met with representative from the Greater Minnesota Parks and Trails Commission. Our regional designation for both the Sioux Line and Belpre Park will be heard by the commission on the 27th or 27th meeting, so we'll be hearing following that where we stand with regional designation of those two facilities.
Excellent.
So that's where we're at, Mr. Chairman, members of the board. If you have any questions of me, I'd try to answer those, or otherwise, that's all I have.
Anything at all for Steve?
Thanks for the update.
Sounds like you're getting off the hook pretty easy there,
Thank
Steve.
you very much. Appreciate
You bet.
that.
Thank you.
Morning, Pete.
Good morning, everyone.
Good morning. How are you today, sir?
Doing wonderful.
Beautiful. Thank you.
See you later. Oh, I thought you were leaving.
I should.
How you doing?
Hey, Mike, how are you?
Good.
Good. See you.
I'm here.
So next, we're going to have our building project update. Pete, you're on the air.
Mr. Chair, members of the board, good morning. Just going to give you a quick budget update. Not a whole lot has changed since the last meeting in May when I presented. Overall, once again, the contingency outside of that earlier generator and some of those underground plumbing issues that we came across has been kind of holding its own. Since the last meeting, I think we had one minor change order to R&H drywall for some additional patching, taping work in the 70s building. So with that being said, not a whole lot's changed, and if there's any questions on the budget, I can address those. Otherwise, I'll talk a little bit about the current schedule and kind of where we're at.
Gentlemen, questions? No. Carry on.
Schedule-wise, currently in the 70s building, second floor, we're into the finishing stages. Most of the painting has been complete. Bathrooms have been tiled. Acoustical ceilings are going up, which are the drop-in ceilings that you see presently here in the council chambers. Along with that, electricians are falling behind now and dropping in some light fixtures, sprinkler heads going into the final elevations. So that floor is coming along nicely. In any case, we're down on first floor. Painters have started their work down there, along with finishing up the rough-in. So as the finishes start to go on second floor, once troops get caught up, we just drop down one floor and continue on. So that's the order of how we're finishing it. Last couple of weeks, you probably saw the west parking lot get filled up with a whole bunch of insulation. Buttweiler started on the roof of the 70s building, approximately about 20% complete with that. And they'll maintain a presence the bulk of the summer putting the roofs on this building. So,
Questions? Concerns?
When that section is completed, will the people go in there that belong in there and stay there? And then where do all the other people go that are in the next area that gets?
So when the 70s building is complete, everybody will locate there where they'll permanently be.
Okay.
And then that will free up that basement where the temporary locations are right now. And so that's going to be finished off, and that'll be worked on to get to as close to complete as possible.
Okay.
And then folks from upstairs will move down to be able to work on a portion of the upper part, and then there'll be a little bit of movement depending upon which areas and what group of staff might need to move, but that's the next portion of them.
Sounds good.
Mr. Chair?
Yes?
Where are we with that noise elimination?
That was going to be a question that I needed to ask you. I know Commissioner Winter had wanted to go visit, and I had put you in contact with Otter Tail,
Yeah,
and
they
you
never
talked to them.
got back to me at all. They were going to give me some information.
I was going to say you spoke with him, though, I thought.
Yeah, I did, but
Okay.
he was going to send me something,
Oh.
some, information more on it, and I thought he said he was going to send you some, too.
They were following up with a few questions that I had. I know I haven't seen a response yet. That was later last week.
Right.
I will see where it's at with that. I had sent you brochures and information on that. I don't know if you have any questions from that in regards to how that works.
I guess maybe this is not on, but they've been out a while. I think they said they installed it in that, I get the county, but it's Douglas County or?
It was Otter Tail County, and I believe it was,
like 10 years plus
Yeah,
ago,
yeah.
which is amazing. I thought it was just something new.
no, I didn't know of it.
It's
though.
something new to us, I think.
Right.
Yeah, yep, it's
Well-
something new to us.
But anyway, the administrator said that based on what his information was, he was impressed with it, but again, that was just one thing that he said, but he had other challenges with it too. So as far as operating it, having people be able to, adjust it, where they have to come in, down the road. So his training was something that he was concerned with.
That's what we talked about a lot. I asked him regarding, what would you, is there anything that you would wish you had known prior to doing that and whatnot? And he had indicated that it takes adjusting, and that's what part of the information that we got initially too was you'll have to play with it a little bit to see what level is most effective in that area and the different zones that we have bid on, which is the three different, one is the land services and then the upstairs and the downstairs of that east portion of the building, would need to be kind of adjusted according to how the effectiveness of it, to how staff are responding and whatnot. So, yep, that is part of the deal.
More to come?
So, more to come. If there's more questions, you have more information that we ought to be receiving for you in order to be able to make a decision on implementing that, because it is something that would go in after ceilings are up and prior to furniture moving in. So it will be this summer sometime that would need to be decided upon.
And personally, Mr. Chair, I'd like to visually hear it, as they say.
You need to go for a road trip.
As I had to say, visually hear it, see.
No, I got
just
you.
to see what, how it works.
Yeah, I did speak with the person that the representative for the company, and there are companies in central Minnesota that have deployed it, but a lot of them are healthcare facilities, and they're not going to shut down their systems for, you guys are very important, but they're not going to stop their business for that. Otter Tail certainly would. John Dinsmore, the administrator, is like, oh, absolutely, that's a Fergus Falls trip. And so I'm more than willing to go there with Randy. I've heard it, I've seen the impact or I've heard the result here. I'm visually hearing things
That's
too.
what I said, it's hard to say to you visually hear it.
I think
Did you ever get a
schedule
price?
road trip for whomever.
Does everybody want to go? That's not what I
don't need
heard
to
last
go.
time. Okay.
You just need to schedule a road trip maybe for some.
Is it electrical? Is that how it works? Is it speakers?
Yep.
And then that has to go in soon to the area that we're working in right now,
It's after
correct?
the ceilings are done, but before furniture. So there's carpeting. There's all of that needs to happen too, which will be going in.
But
You
this
said
is
the
not,
tiles are going in though, right?
The ceiling grid is right now, and then they're doing the edge cuts, but yeah, there's a point in time where once the tiles are in, you know what happens when you lift them out, you end up marring them or nicking them. So the one thing that we did investigate was whether or not we can have maybe potentially Holden to do the cabling currently since they're on site, and they said no, it's a system that we want to put in fully since we're fully responsible for the design of this. And I think a lot of it has to do with the acoustics of the space and where these things are located. So,
but we were not going to do this for the 70s building, were we? Was that
The land service, that big
Services.
open area.
so not the social services? Was that another
Yep,
one?
the three.
So,
Public health.
Did you ever get a price about what it
Yep, it was
cost?
about $23,000 for total cost. That wasn't that invoice, that was the information I had sent you guys in email. So like I had presented and talked about last time, it was about $170-ish per employee when it came down to it. I can tell you that the biggest feedback that we received from staff or you guys want to, I'll wait. Because I think they have you had the questions.
I
We good?
guess, Mr. Chair, but what I heard I guess I would be for let's get it done. And then we don't have to worry about it anymore. If it helps the employees and the staff and the people that are coming in there to maybe be a little bit more confidential, as they say, maybe I don't even need to go hear it. And Deb, I'll put my trust into her to take care of that. And
which is scary, but.
I never said that, see?
I would agree with
Especially in the social
that.
service aspect, because right now they're in individual rooms almost, and they're going to be going to an open format, and it just would be horrible if we didn't, and it was really distracting, and a lot of personal information is being heard across the rooms, and
And my concern was it was something new, and I can't believe that's been out that long already, so that was my biggest.
It has been, and that's something that I wish we would have known about at the outset of this. If you are comfortable with, based on the invoice, hold on a second, based on the invoice that was presented, approval of that now would allow me to move forward, but if you want more information and have me bring it next board meeting, I certainly could do that.
I'll make the motion, approve not more than exceed 25,000.
I would look for a second.
Second.
Further discussion on the noise reduction system. I think that's kind of what it's called.
Sound management system, but
On the sound management system. Hearing no further discussion, is this a roll call?
yes.
This is a roll call. Commissioners, Wincher,
Aye.
Lemire,
Aye.
Wilson,
Aye.
and myself is an aye. That motion passes. And now I believe, Commissioner Lemire, you're going to take off because you have another appointment up by the lakes.
Yep.
Have a good day. Thank you very kindly.
I just think this is a good time to do that
This is
before
a
we
great
get
time to
everything,
do that, to
before
get
we
it
get the
done.
walls closed up, and it's not that much money for something that might benefit us quite a bit down the road.
When it comes to a per employee cost, for
Yes.
what I have heard is their greatest concern, mine too, Brad's also, all of the leaders in those areas. It's a real issue. It's very distracting
Yep.
to work without that. So thank you.
Absolutely.
I think that'll be a good tool to deploy.
Anything further for Pete? I know it seems kind of weird that we are just bringing in here for about a 2-minute shot, but
Nope.
I appreciate you stopping in and giving us an update.
Anytime. And once again, like I said, if you ever want to sneak up there, if you haven't already, grab Mike and
bet.
take a little walkabout.
Thank you very, very kindly. I appreciate
Thanks
your
again.
time.
Yeah, thanks for the
Have a
good job.
day.
On that vein, I just wanted, and I'll send it to the other two that aren't here right now, but talk a little bit about where we're at with furniture. This isn't running very nicely with me here. Okay, so we are at the point where we're looking at more specifics when it comes to furniture, especially getting that order down for that 70s building, which is coming up on that. They're working on getting that aggregate price total for us so we can make some decisions about funding and if we have contingencies built in that suffice when it comes to that. But this gives you kind of an idea on generally what we're looking at for typical office or typical cubicle arrangements.
How tall are they, Deb?
These are the
Probably looking right at it, I'm
Yep.
sorry.
These are the 42-inch height that are illustrated right now,
sorry.
but it goes from either the 42-inch height or the 57-inch height, depending upon a function. This is a six-pack of a 42-inch height that's being illustrated.
Deb, what do you, 42 people can kind of lean over, 57, they probably wouldn't be able to.
The difference is standing privacy or
Right.
sitting privacy,
Yeah,
and that's the
exactly.
difference. For those pods, 6-pod, if you recall, like at the auditor, treasurer, land services, those front areas, that's where the lower height comes into play. The taller standing privacy height will be for those that the appraisers back in the corner or social workers, nurses, things of that nature.
Cost difference? Do we know?
The panels that are bigger are a little bit more, but that's what we're waiting to see is all of that in aggregate. I mean, it's one of those where for some of the work, it just makes sense to have the higher standing privacy panels, and some of it doesn't because they're covering a counter and they need to be seated and see what is going on when it comes to servicing the counter.
Some of that, Deb, do we have the desk, that the computer things that, right? So in other words, some people will be standing while they work,
Yep.
and so that would make a difference too.
These are, they're not standing privacy, but all of the desks would go up and down that where the computer monitors are located, or you can see those drawn. That's the surface that is designed to.
I'm guessing
stand
that's
sit.
not standard in the world we live in today, but it's got to be doggone near standard.
To have it stand sit.
your desktop moving up and down.
Most of them
It's just,
They're gonna make one for you. when they
it's
have
just
board.
the way it is.
Yep.
That's how people work today.
But it's a chair, it's one of those.
They've actually said that they don't really do much installing of brand-new stuff that doesn't have that option, just because it's gone down in price
I can't
so much.
imagine.
So this gives you kind of an idea on- from a side view on what that looks like.
We're not gonna have like treadmills for their employees either.
No, we're not doing that. Yes. I know you're kind of on the trending, up and coming thing, vein, but no,
Health kick.
that wasn't what we were proposing. And so
This
as
is
you
what
can
we put up with.
see, there's different options that we're going to look at. The yellow that's designed as a cushion, so that way if somebody comes in, sits down with somebody, we can add that or not add that, whether it be on a file cabinet or on the back credenza that's there. There's shelving that can go on the wall that hangs over the work portion, or it can go on the back that would hang over that credenza that's there. There are different things that will allow for specific choices within their area, whether it's a flat shelf or whether it's an organizer like is hanging there now.
This will be within your budget, I'm assuming.
That's what I'm waiting to see. Otherwise, what isn't covered in the full project budget would then all of a sudden would be individual departments as they do now. If there's a piece of equipment that they need to work that into their budget.
I'm going to be hard pressed to say, pick that one or pick that one or pick that one.
Well, I'm not asking you to, so
Okay.
maybe that's a good thing. This is
It's
just,
a
I'm showing
great
you
thing.
kind of overall what it is that we're offering to staff, and you'll see what it looks like when it comes to
So are you
colors.
offering it to staff, or are you offering it to the team that's picking this out? Because when you offer something to staff, you have a lot of staff
Yeah.
that works here. We're all going to have an opinion.
Yep, and I'm giving you very limited choices. Like
Thank you.
this, do you want a flat shelf
Okay.
or do you want an organizer?
Gotcha.
Those are things that we're offering down to the individualized basis, but not, this is overall what everybody's getting in terms of the basic furniture
So
option.
you're not going to offer everybody their own color.
No.
Okay.
The darker wood is the color that the tops will be. And then the sidewalls are very close to what if not exactly what I think they do it exactly, honestly. I don't know how the computer system works, but that's what they'll be. Kind of gives you, again, an idea whether it's very limited, minimal differences, but something that would offer some choice.
That looks pretty standard to what we have now, except desk, there was the cubicles that we took down. The tables will go up, which people, a lot of them on health-wise, is good for them to stand up.
This gives you an idea on the lower level where probation is. IT, we have existing furniture, I think that we'll be able to use for that over there. This will be the offices set up in probation, and then also the IT training room or the different conference rooms that'll be there.
Where is the extension going?
Extension is going in the upstairs of the 60s building when they move.
All right.
This gives you kind of an idea on just a desk area. I'm hoping we can have upper units that exist right now instead of what's shown as brand new, because we do have a lot of those upper units.
Deb, when you talk about this, is every spot getting new stuff, or
Nope,
were there
that's-
desks and stuff that are being used from the old?
That's what I was just saying. IT is going to have existing furniture. We're hoping administration can be outfitted with existing furniture. Individual offices mostly should have existing furniture, like the land services area that'll have existing. What we are putting in the hopes to do is how do you want to say it? Using the same desktop, but putting in one of the bases that will go up and down instead of all new furniture. A lot of them can be retrofitted to do that.
So you're trying to use the stuff that's capable of being used and replacing
They
the other
saved your
stuff?
board chair too, just to let you know.
What's that? They saved my
saved your
board
board
chair?
chair.
Well, thank you. I appreciate that.
That I didn't do, but yeah, we are absolutely using what we can where it makes sense and where
that's
it's in
good.
good enough shape to do that. Keeping in mind, though, the open areas that are new, we are trying to have similar furniture out there.
And if you gotta go with new, you gotta go with new, if it doesn't fit.
how it works.
Yeah. And some of the ergonomic changes and things like that, making it make sense. This kind of gives you an idea of the general land services areas. The counters aren't drawn in, but as you can see in the back, the offices don't have furniture shown. It's because that's being reused from what is existing. We're not ordering new. So the bulk areas are what you see as new materials, or new furniture and equipment. Just an example of what she had drawn for the waiting area and that lobby area up on top of the first floor.
That
These-
really looks like that's opening that up quite a bit. That looks like that's going to be good workspace. I was in there the other day.
Yeah.
That looks good.
These are an example of the taller ones, so the standing privacy cubicles that'll be there. Again, different options on how they want to set them up will be available, but gives you a general idea. And I'll give staff a general idea on how that's going to be identified or organized.
What is the dimensions of that? Are they like 6 by 6 roughly? I forgot to look.
I don't know why this thing is.
That's no big deal.
Well, no, it's right here on the bottom of it. It has,
What was it again?
oh, it shows the primary work surface as 30 by 72, and then the return surface 24 by 84, so it would be,
54 by...
yeah, you have to add the two. Yep. They're good-sized spaces when it comes to what we've seen in our different areas. These are just an example of the little conference rooms and the chairs that we'll have with those. Just some of the millwork and things that'll be done. So just gives you an idea on what we've been working on. We're meeting with those departments to make sure we finalize the 70s order, but I want the aggregate total on where we're at. If we're way off when it comes to what we've had budgeted for the furniture, we need to revisit it in some form or fashion and identify what it is that we think is important enough to talk about adding, or what we need to cut in regards to what's an option. So just giving you an idea of what's out there.
Looks like you got it under control.
A couple other things. We are working on scheduling a couple of different meetings. One would be with Camp Ripley. We're working on trying to get dates solidified with that, just to meet and now that Commissioner Blaine is on board and connect again. And then now that Commissioner Blaine is on board, we also talked about a city-county meeting, if you remember way back when, to get together with the city council again and to talk about just combined efforts and issues that are arising. So that is trying to be scheduled too. We have emails out to them. I'm working with the insurance committee. We met last week and talked about the 2019 insurance renewal. As I maybe briefly updated you on this, the increase is significant based upon the utilization that we had. We have rate caps in place, so that's good. We are moving bands within the Logis group due to our experience really is what is driving that. And so I worked with them in the units, and the union contracts need to be, each union needs to address a MOU, a memorandum of understanding. Typical arrangement that we've had in years past, if there's an increase, we split that. So the county would absorb half of that increase, and then employees would absorb the other half. And so that arrangement was talked about and discussed, and we'll hopefully get those back soon.
Do we ever, again, I know we talked about self-insured, that we're not large enough probably yet.
We've looked at it, and especially within the Logis group, when we went out to bid in the prior, this is the first year of a new contract with Health Partners. That Logis group very seriously looked at self-insurance within that larger pool, and it just wasn't as cost effective. It's kind of funny. Some counties do and are just very, very pleased with the results that they've had, and other counties have been self-insured. And Itasca County, for one, if you see any counterparts with Itasca County, they had to get out. It almost bankrupted. It was unbelievable.
AMC, I was talking to some commissioners about that, and it's, again, you got two different sides.
Well, and Cass County has been very, very glad that they've been self-insured for many, many years. With all the rules changing with the Affordable Care Act, insurance is just such a different thing. It doesn't work like it used to. And so every year we look at individually where we would be at if we pulled out of the Logis pool, and we look at what it is as a group that would look at. Our increase that was required as an individual Morrison County only group, according to Health Partners, based upon the previous year's experience, was 56%. This isn't a year I'd recommend we go out to bid on our own. Our experience and what the new companies would look at would be ridiculous.
But I just like to have that keep in the back of our mind, saying that's...
Oh, absolutely, absolutely.
Especially with healthcare.
It's that initial buy-in. It's having enough cash to be able to pay. And I like self-insurance because you can you're not at the mercy of healthcare companies on how they price things and what they do with it. So I really like that aspect, but boy, you get a really bad year, you got to be prepared for that.
I sit on a lot of those boards on insurance, and it's amazing how you go along and you're the bottom of the totem pole, then boom, you're on the top. And when you're on top, people don't want to bid you.
Doesn't take
You know, so I know it keeps going up, and I don't agree with that, and I think some of these organizations should be able to help bring that down. But it just seems like if you're on your own and you hit the bad one, it's bad for everybody.
Again, we discussed that with South Country.
Yeah.
They had some prescription drugs were like $300,000 or $600,000.
No, $125,000 a piece, and it took 4 shots to start it.
Yeah.
I'm just trying to actually look, one of the slides that I want to look at
Yeah.
and show you. This is about our renewal. Morrison County history. The average increase to premium needed based on experience is 12.9%. This shows from 2010 to where we're at in 2018. The average negotiated change to premium was 4.9%, but the average annual premium change based on enrollment over the last 8-year period has been 2.9%. We've had some very good years. We were able to capitalize on that, and the timing hit very good in terms of being able to do some adjustments. That one year in 2013 when we started it was 2012 when we started that new contract. You'll see where it dips is where you go out to bid, and then the next year it goes up. It's annoying, but it's predictable. That's how they work. We ended up capitalizing on that and doing some modifications to be able to really adjust, taking that savings that we received and be able to do some work with family coverage costs and cafeteria contributions and where we're at with that. And so it's a reminder that we've had really good years and we've been lower than the average LOGIS rate in the past based on our experience. This year we had a bad year. The numbers very much dictate the fact that we have an increase larger than the average pools.
But we're also locked in on a fee where it can only go up so much this year, right?
Yep.
So maybe next year things will come down. We'll get, something will happen where people aren't down there, and it'll help us bring it back.
You can kind of see when the premium for Morrison County history is more than the claims, that's good. When it inverts, that's the problem, and that's what's been happening. We've, it's a hit or miss. That's the beauty of being in a pool. The rate cap for this year is 10%, but as I said, the pool change is what's adding that extra 5%. So total 15% will be provided or given to Morrison County for the adjustment. You can only change 2 bands. Each band is 2.5%. And so we are going the max change that we can go based on our.
When you're self-insured, you only go out so far and then you're insured again, right?
They have usually you have reinsurance or you have that extreme.
I even think the insurance companies are
We have that too.
reinsured.
Yep.
Yeah,
There's the top, I think we had the top 7 claims within the county were taken out of consideration when it comes to our history because of that.
Because really you're insuring about that first $250,000. After that, other insurance companies are starting to kick in.
Yep, our pooling point for the size of our organization within the LOGIS is $70,000. And we had, I think, 7 claims more than that.
Yeah.
And our rate caps for the rest of this contract period with Health Partners, as you can see, are 11% and 12%. That's just the rate cap as the pool as a whole. If our experience warrants it, we could be more or less than that.
I just have a hard time when they say only 11%.
Oh, I agree.
Only.
But when I see 56.6%, that's a problem.
Yep.
It's not possible.
Understand.
They're doing a lot with some of even the service cooperatives, and some of the increases needing for some of these smaller organizations are just unbelievable when they've looked at that.
Well, and then Health Partners, and a lot of them are not even insuring companies with less than 100 employees.
No.
They're having to find their own. They're kicking them out.
Yep. And actually, they had to, the small employers, less than 50, I think, had to go out of any type of pooling when, was it 2012? I think that was the first year that we had to make that decision. Well, now ACA changed and such that they'll let them back in. So we are talking about that as a LOGIS group. I'm a member of that LOGIS insurance committee too, so I get a little bit more involved. But we are talking about whether or not we let them back in. And oftentimes those small groups have really good experience. Their numbers aren't huge, but they usually, well, history says that they have pretty good experience, so.
Well, a lot of it
There's a
goes
cost
to,
to that, though, to let them back in for that group, too. They have to pay up.
It has to make sense, absolutely, absolutely.
and nobody wants to take on one that's going to put you in debt.
Right.
No.
I mean, that's just the way it is.
But insurance is based on numbers, and it's
Yeah.
based on chance, and it's based on those likelihoods that things are going to happen, so. But anyway, that's being worked on, that's coming forward. Another thing that went out to the group is a revision for personnel policies. We've talked about those at the department head group. It's time, again, it's been a number of years since we revised those. Bring them up to date with current practice and policy. Adjust things that we find that could work better, things of that nature. So they're out, that first initial revision is out, and I intend to bring that to you, what's out there in a planning session this month. So you'll be able to see that. There's nothing super drastic that's changing or anything crazy with how we do general business, but smaller things that seem to make sense. We ran those by the department head group. We're running it by the bargaining units just to let them know that it's happening, and then we'll bring them to you in a planning session and then eventually have those addressed at a county board. What else? Anything else that you guys have or need from me
Not
or
really.
that I'm missing for you guys?
I think you're caught up.
Am I? That's what I was going to update you on.
I think it's time to ask for schedules. Commissioner Wilson?
Just a minute, I got to get
I
to
think
it.
we're going to go through from the 24th to the 14th of July.
14th of July, 3 weeks.
Okay, on the 25th, we've got a planning commission at 7 o'clock in the evening. On the 26th, planning session at 8:30 in the morning. Gosh. July 3rd, planning session at 8:30, Board of Adjustments at 7. And how far did you say, the 7th of July?
I don't think on July 3rd we have anything.
I didn't think we did either.
On what day did you say?
July 3rd.
I've got planning session and Board of Adjustment here, so do we have that on Monday or something, or do we have,
We're skipping that week altogether
Yeah.
for
Okay.
our board.
Yeah.
okay, so that, on Board of Adjustment being deleted too?
It was
I
just,
don't know.
Okay,
I haven't gotten anything from them yet. For any,
I have nothing for that either.
no.
Usually July 4th week, especially when there's five Tuesdays, we will kind of take that, and that one's one that, I know I won't be around, I'll be gone all that week, but.
I think as it is right now, we have nothing on the
okay.
3rd.
That must have been one of those automatic ones that came on my calendar.
Yes.
So really, that's all I got. I don't have nothing at the very end of July, or June, and 4th of July week.
It goes to the 14th, though.
Oh, okay. The 10th, I've got strategic planning at 11 o'clock, and we must have a planning session that day.
Board.
We have a
Board
board
meeting?
meeting.
Okay, I've got the CHB board on the 11th at 3 o'clock. Greg is going to have South Country on Thursday, because I got that on my calendar.
Is that on the 5th? Because I have it's the first Thursday?
I've got it on my calendar. It came up on the 12th, or on the 12th, yeah, South Country.
I bet they wouldn't.
But you're right, it's usually the first Thursday.
First Thursday typically, I just don't know, sometimes they switch it and don't tell me that.
Okay. Okay, that's all I got.
Commissioner Wincher, starting with the 24th of June.
So Monday, Tuesday covered. Wednesday's covered. Thursday, I'll be soil and water at 9 o'clock on the 28th. And then we'll be doing interviews down in St. Cloud for University of Minnesota Extension at 11 o'clock on the 28th. That's in that week. We'll have an extension meeting at 5:30. I don't know where that's going to be. At 9 o'clock on July 9th. Excuse me, at 5:30 on July 9th. I don't know where it's going to be at yet, so.
I don't know where that is either.
And then there's a department head scheduled right now at 8:30 on Wednesday, 11th. And that is it for me.
And for me, starting the 25th at 5 o'clock, I've got a Stand Up For You meeting. That's going to be held at the Zion Lutheran Church in Little Falls. There's a Live Better, Live Longer farewell of some kind or another. I think it's going to be at Sprout, and I believe it's at 4 o'clock on the 26th.
I think that's their last meeting
Yeah.
of because they lost their funding.
And on the 29th, at 10 o'clock in the morning, I've got an EMS Joint Powers Board meeting at the Stearns County Service Center
Do anything on the 28th?
Waite Park. On the 28th,
That was canceled?
the 12:30 State Emergency Communications Board is canceled.
Okay.
And the 5th of July hasn't been canceled yet. 10 o'clock in the morning, I've got an Armor Legislative Committee conference call. And as we spoke of earlier, on Friday the 6th, TSWAC has been canceled. I have a Toward Zero Death meeting that I will be canceling out of because of strategic planning on the 10th. Trails on the 12th has been canceled.
Okay.
And on the 13th, I have an Armor RAC meeting that I believe is in Little Falls at the Little Falls Fire Department, to the best of my knowledge. And Tabitha, that's all I have.
Do you have your O&O on the 12th?
Don't have that one down. At 10.
That's why we have Tabitha.
That's right. At 10. Armor.
And you said the one on
Oh, no.
the 5th was just a conference call, right?
The 5th is a conference call. That's at my house.
Okay.
And, oh, no, I've got that now. That's all I've got. Gentlemen, do you have anything further?
So moved to adjourn.
Second?
Discussion? Hearing none. This meeting is officially adjourned. It's 10:49.